Hello, welcome to the Division of Fee-for-Service Management Provider Training. Our presentation today is titled Behavioral Health Residential Facility, Access Medical Policy Manual, Policy 320V. This presentation has been developed as a resource for providers to assist with understanding the Policy 320V as it applies to behavioral health residential facilities. Please note that these materials are designed for fee-for-service programs including American Indian Health Program, Tribal Regional Behavioral Health Authority, and Tribal Arizona Long-Term Care Services, or ALTCS. The content that we will go over today will be the Access Complete Care Health Plans, Member Verification Responsibility, Access Medical Policy Manual, and that again is Policy 320V, Division of Fee-for-Service Management Prior Authorization Requirements, System changes for HCPC codes H0031 and H2019, Behavioral Health Residential Facility, Continued Stay Prior Authorization Request, and Personal Care Services and Licensing Requirements. So the Access Complete Care Health Plans became effective on October 1st of 2018. This new integrated system will join physical and behavioral health services together to treat all aspects of our members' healthcare needs under a chosen health plan. Access Complete Care encourages more coordination between providers within the same network, which can mean better health outcomes for members. Members that are enrolled in an ACC plan are not managed by Access Fee-for-Service. Behavioral health residential facility providers must contact the ACC plan for prior authorization and claim submission requirements. On this slide, we've shown the different geographical service areas and the health plan that is assigned to that particular area. For the North GSA area, Care First and Stewart Health Choice Arizona service those areas. For Central GSA, we have Banner University, Care First, Stewart Health Choice, Mercy Care, Arizona, Magellan United Healthcare Community Plan. For the Southern GSA area, we have Banner University Family Care, Arizona Complete Health, United Healthcare Community Plan. Now let's talk a little bit about the member verification responsibility. Access recommends that all providers utilize the eligibility and enrollment verification options provided directly by Access to verify the member's current eligibility and enrollment status. Even if a member presents an Access ID card or decision letter from an eligibility agency, status may change at any time. Providers may use any one of several verification processes to obtain eligibility, enrollment, Children's Rehabilitative Services, and Medicare and TPL information if available. For member verification, providers may use the Access Online portal, and we have provided the link to that website for your use. To create an account, click on the URL and simply follow the prompts. In addition, providers can use the interactive voice response system, and we've provided the contact numbers for that access as well. Members' enrollment and health plan responsibility. For Title 21 Kids Care members that are enrolled in the Access Complete Care or ACC health plan, providers must contact the ACC health plan for prior authorization and billing questions. American Indian members that are enrolled in the Access American Indian Health Program, providers must request authorization from the Access Prior Auth Unit and submit claims to Access Fee-for-Service. American Indian members that are enrolled in an Access Complete Care or ACC health plan, providers must contact the ACC health plan for authorization and claim submission guidelines. On this slide, we are going to go over the Access Medical Policy Manual. Again, that is Policy 320V for behavioral health residential facilities. For behavioral health residential facilities, the Arizona Administrative Code R9-10-101 states, as specified in the Arizona Administrative Code, A behavioral health residential facility is a healthcare institution that provides treatment to an individual experiencing a behavioral health issue that limits the individual's ability to be independent or causes the individual to require treatment to maintain or enhance independence. Under the AMPM Policy 320V, we will discuss access prior authorization requirements, criteria for admission, behavioral health assessment, treatment and expected treatment outcomes, criteria for continued stay, discharge readiness and discharge planning, and behavioral health residential facilities with personal care services. Effective April 1st of 2019, all admissions and continued stays at a behavioral health residential facility for members enrolled in the American Indian Health Plan, and that plan ID is 999998, and Tribal Regional Behavioral Health Authorities, or TRBHAs, will require prior authorization for the admission and continued stay beyond the initial prior authorized or approved dates. At the implementation of the prior authorization requirement, behavioral health residential facilities were required to submit a prior authorization request for any members that were currently receiving behavioral health services in a birth prior to April 1st of 2019. The prior authorization had to be submitted for approval of the member's continued stay by May 31st of 2019. As an important note, per Title IX of the Arizona Administrative Code, R9-22-201, a prior authorization is not a guarantee of payment. All types of medical, clinical, and behavioral health documentation can be uploaded to link with the prior authorization using the Access Online Provider Portal. Examples of documentation that can be uploaded include behavioral health assessment forms, updated treatment plans, continued stay request, and discharge planning documentation. Please note, providers may also use the Access Online Provider Portal to check the status of their prior authorization request. This includes viewing any additional comments that may have been entered by the prior authorization staff. For prior authorization and Indian Health Services Tribal 638 behavioral health residential facilities. Behavioral health residential facilities that are designated as an Indian Health Service, IHS facility, or a Tribal 638 facility that is being operated by a tribe or tribal organization do not require prior authorization. No prior authorization is required for IHS 638 facilities for members enrolled under Title 19. Mandatory notification process. Contractors and behavioral health residential facility providers shall ensure appropriate notification is sent to the primary care physician and behavioral health provider, agency, tribal regional behavioral health authority, or tribal ALTCS program upon intake and discharge from the birth. Now we're going to go over the behavioral health residential facility admission guidelines, which may include a direct admission from a behavioral inpatient health facility, crisis system, and an urgent admission. So direct admissions to a birth from a behavioral inpatient health facility. If the member is admitted directly from a BHRF, the crisis system or the pre-admission evaluation determines that the member needs an urgent admission, prior authorization is not required. BHRFs shall submit the behavioral health residential facility admission notification form via the Access Online Provider Portal. DFSM will authorize up to an initial 5 days for this type of admission. Births shall submit all required documentation to receive prior authorization beyond the 5th day. To continue, continued stay requests beyond the 5th day will require prior authorization requests via the Access Online Provider Portal, and these must include all clinical documentation necessary to support the need for the behavioral health residential facility stay. The administration or contractor may deny a claim if a provider fails to obtain prior authorization. Prior authorization information for births can be found at the URL that we've provided here. Now let's move on to discuss the behavioral health assessment. Notification of admission. Admission documentation that is required for the prior authorization request includes, for the behavioral health assessment, in compliance with Title IX of the Arizona Administrative Code, Chapter 10, to determine behavioral health condition and diagnosis. Assessment means an analysis of a patient's need for physical health services or behavioral health services to determine which services a healthcare institution will provide to the patient. This information again may be found in R9-10-101 of the Arizona Administrative Code. The assessment should be recent and not older than 1 year and performed prior to the behavioral health residential facility admission. The assessment can be done by a behavioral health professional, or BHP, or by a behavioral health technician, BHT, and co-signed by a behavioral professional. Utilize standardized instrument that is able to determine the appropriate level of care needed by the patient. Prior authorization requests shall be submitted prior to the planned admission date. Initial prior authorization may be issued for the period of up to 90 days based on member need and documentation. Now let's discuss the treatment plan. The treatment plan, completed in compliance with Title IX of the Arizona Administrative Code, Chapter 10, by the Inpatient, Outpatient, or TRBHA Regional Behavioral Health Authority treatment team. For the purposes of this policy, a complete written description of all services to be provided by the birth. The treatment plan shall be based on the intake assessments and outpatient service plan. Included in the service plan should be an intervention specifying the birth level of care as necessary for the member as the least restrictive level of care required to treat the behavioral health condition that is identified in the assessment. This treatment plan should not be older than 3 months from the request submission date to the behavioral health residential facility. Now let's discuss behavioral health residential facilities' responsibility of care and services. The behavioral health residential facility maintains core responsibility for the member's medically necessary services and align with the Access Medical Policy 320V and the facility's license. If an outpatient behavioral health clinic is also asked to provide services to a member who is receiving services from the birth must provide the member's assessment and treatment plan in order to ensure appropriate care coordination is occurring, for example, to avoid duplication of services, as well as ensuring the behavioral health outpatient clinic is only providing the specialty services not being provided by the birth, as indicated in the member's assessment and treatment plan. Now we're going to move on to review the admission policy under Policy 320V, and again, this is for behavioral health residential facilities. BHRF providers providing services to fee-for-service members are required to adhere to the elements listed in the Access Medical Policy Manual, Policy 320V, for behavioral health residential facilities. Under Bullet 1, member has a diagnosed behavioral health condition which reflects the symptoms and behaviors necessary for a request for residential treatment. The behavioral health condition causing the significant functional and/or psychosocial impairment should be evidenced in the assessment by the following. Under Bullet A, at least one area of significant risk of harm within the past 3 months as a result of Bullet 1, suicidal aggressive self-harm homicidal thoughts or behaviors without current plan or intent. 2, impulsivity with poor judgment or insight. 3, maladaptive physical or sexual behavior. 4, members' inability to remain safe within his or her environment despite environmental supports, and for example, national supports. 4, medication side effects due to toxicity or contradictions. Under B, at least one area of serious functional impairment is evidenced by 1, inability to complete developmentally appropriate self-care or self-regulation due to members' behavioral health condition. 2, neglect or disruption of ability to attend to majority of basic needs such as personal safety, hygiene, nutrition, or medical care. 3, frequent inpatient psychiatric admissions or legal involvement due to lack of insight or judgment associated with psychotic or affective mood symptoms or major psychiatric disorders. 4, inability to independently self-administer medically necessary psychotropic medications despite interventions such as education, regimen simplification, daily outpatient dispensing, and long-acting injectable medications. Or 5, impairments persisting in the absence of situational stressors that delay recovery from the presenting problem. C, a need for 24-hour behavioral health care and supervision to develop adequate and effective coping skills that will allow the member to live safely in the community. D, anticipated stabilization cannot be achieved in a less restrictive setting. E, evidence that appropriate treatment in a less restrictive environment has not been successful or is not available, therefore warranting a higher level of care. And F, member agrees to participate in treatment. In the case of minors, family, guardian, designated representative also agrees to and participates as part of the treatment plan. Now let's talk a little bit about the behavioral health residential facility criteria for continued stay. Continued stay shall be assessed by the behavioral health residential facility staff and is applicable by the Child and Family Team, CFT, Adult Recovery Team, ART, Tribal Regional Behavioral Health Authority, TRBHA, during the treatment plan review and update. Progress towards the treatment goals and continued display of risk and functional impairments shall also be assessed. Treatment interventions, frequency, crisis, safety planning, and targeted discharge shall be adjusted accordingly to support the need for continued stay. The following criteria shall be considered when determining a continued stay. 1, the member continues to demonstrate significant risk of harm and or functional impairment as a result of a behavioral health condition. 2, providers and supports are not available to meet current behavioral and physical health needs at a less restrictive lower level of care. Behavioral health residential facility requests for a continued stay shall be submitted to PA at least 2 weeks prior to the last approved prior authorized date of the behavioral health residential facility stay. The prior authorization online portal does not allow changes to a prior authorization that has been changed from a pinned to an approved status by the PA team. A request to extend the current authorization can be done by using the Access Online Provider Portal. To update, go to a Prior Authorization tab along the menu and search for the prior authorization case. Select the appropriate case or PA number and then click on the Attachment tab. Include all documents that support the continued stay request, the dates of services. Make sure all documents are signed and dated by the appropriate behavioral health services professionals, and scan into your electronic device or computer to upload to the prior auth. Behavioral health residential facility services provided to fee-for-service members are required to adhere to the minimum discharge elements below. As an important note, discharge planning shall begin at the time of admission. Per Arizona Administrative Code R9-10-101, the definition of discharge planning is a process of establishing goals and objectives for a patient in preparation for the patient's discharge. Discharge readiness shall be assessed by the behavioral health residential facility staff and, as applicable, by the Child and Family Team, Adult Recovery Team, Tribal Regional Behavioral Health Authority during each treatment plan review and update. The following criteria shall be considered when determining discharge readiness. 1. Symptom or behavioral relief is reduced as evidenced by completion of treatment plan goals. 2. Functional capacity is improved. Essential functions such as eating or hydrating necessary to sustain life has significantly improved or is able to be cared for in a less restrictive level of care. 3. Member can participate in needed monitoring or caregiver is available to provide monitoring in a less restrictive level of care. 4. Providers and supports are available to meet current behavioral and physical health needs at a less restrictive level of care. Now we're moving on to the admission, assessment, treatment, and discharge planning summary. Behavioral health residential facility providers rendering services to fee-for-service members shall follow the below outlined admission, assessment, treatment, and discharge planning requirements. Number 1, except as provided in subsection R9-10-707A9, a behavioral health assessment for a member shall be completed before treatment is initiated and within 48 hours of admission. 2, the CFT, ART, TRBHA, Tribal ALTCS shall be included in the development of the treatment plan within 48 hours of admission for members enrolled with a contractor. 3, all birth-serving TRBHA or Tribal ALTCS members shall coordinate care with the TRBHAs or Tribal ALTCS programs throughout the admission, assessment, treatment, and discharge process. 4, the treatment plan shall connect back to the member's comprehensive service plan for members enrolled with a contractor. 5, a comprehensive discharge plan shall be created during the development of the initial treatment plan and shall be reviewed and/or updated at each review thereafter. The discharge plan shall document the following: A, clinical status for discharge; B, member, healthcare decision maker, and designated representative; and CFT, ART, TRBHA, Tribal ALTCS understands follow-up treatment, crisis, and safety plan; and C, coordination of care and transition planning are in process. For example, reconciliation of medications, applications for lower level of care submitted, follow-up appointments made, identification of wraparound supports, and potential providers. The behavioral health residential facility staff and the CFT, ART, TRBHA, Tribal ALTCS shall meet to review and modify the treatment plan at least once a month. 7, a treatment plan may be completed by a BHP or by a BHT with oversight and signature by a BHP within 24 hours. Implementation of a system to document and report on timeliness of BHP signature and review when the treatment plan is completed by a BHT. 9, implementation of a process to actively engage family, healthcare decision maker, and designated representative in the treatment planning process as appropriate. 10, clinical practices as applicable to services offered and population served, shall demonstrate adherence to best practices for treating specialized service needs, including but not limited to A, cognitive intellectual disability, B, cognitive disability with comorbid behavioral health conditions, C, older adults and co-occurring disorders, substance use and behavioral health conditions, or D, comorbid physical and behavioral health conditions. 11, services deemed medically necessary through the assessment and/or CFT, ART, TRBHA, tribal ALTCS, which are not offered at the behavioral health residential facility, shall be documented in the service plan, and documentation shall include a description of the need, identified goals, and identification of provider meeting the need. Now let's discuss services that are included in the behavioral health residential facility daily per diem. The following services shall be made available and provided by the BHRF and cannot be billed separately unless otherwise noted below. A, counseling and therapy, group or individual. Group behavioral health counseling and therapy may not be billed on the same day as the behavioral health residential facility services, unless specialized group behavioral health counseling and therapy have been identified in the service plan as a specific member need that cannot otherwise be met as required within the BHRF setting. B, skills training and development. 1, independent living skills, for example, self-care, household management, budgeting, avoidance of exploitation, and safety education and awareness. 2, community reintegration skill building, for example, use of public transportation systems, understanding community resources and how to use them. And 3, social communication skills, for example, conflict and anger management, same or opposite sex friendships, development of social support networks, and recreation. C, behavioral health prevention and promotion, education and medication training and support services including but not limited to 1, symptom management, for example, including identification of early warning signs and crisis planning and use of crisis plan. 2, health and wellness education, benefits of routine medical checkups, preventative care, communication with the primary care physician and other health practitioners. 3, medication education and self-administration skills. 4, relapse prevention. 5, psychoeducation services and ongoing support to maintain employment, work, vocational skills, educational needs and assessment, and skill building. 6, treatment for substance use disorder, for example, substance use counseling groups. 7, personal care services. See additional licensing requirements in the Arizona Administrative Code, R9-10-702, also R9-10-715, and R9-10-814. Now let's review the system updates for behavioral health providers. This notification was released on July 15th of 2019, and it addresses the HCPC codes H0031 for mental health assessment by non-physician and H2019 therapeutic behavioral services per diem. As an important note, this is not representative of a policy or billing change and is only a system update. For behavioral health residential facilities, this notification was sent out via Constant Contact, and that release date again was July 15th of 2019. Effective July 15th, 2019, Access Administration has closed HCPC codes H0031 and H2019 for the behavioral health residential facilities, and this is provider type B8 in our system. It previously came to Access attention the HCPCS codes H0031 and H2019 were being submitted by behavioral health residential facilities in addition to the behavioral health residential facility per diem HCPCS code H0018. BHRFs receive a per diem rate for the provision of behavioral health services, and per policy, the per diem rate includes mental health assessment and therapeutic behavioral services as part of that per diem rate. Now let's review personal care services as identified in Policy 9 of the Arizona Administrative Code 10, Article 7. Effective for dates of services October 1st of 2019, behavioral health residential facilities that are also licensed through the Arizona Department of Health Services, ADHS, to provide personal care services may begin billing for the H0018, which is the behavioral health short-term residential without room and board per diem code, with the TF modifier to identify personal care services. Services that may be provided under personal care services may include, but are not limited to, blood sugar monitoring, bed baths, application and care of prosthetic and orthotic devices, use of pad lifts, respiration monitoring, and catheter care. There are additional services that are also included under personal care, and providers should review the AMPM policy 320V Section H for additional information about BHRFs and personal care services. Under the Administrative Code R9-10-715 that addresses physical health services, an administrator of a behavioral health residential facility that is authorized to provide personal care services shall ensure that 1. Personnel members who provide personal care services have documentation of completion of a caregiver training program that complies with Arizona Administrative Code R4-33-702A5. 2. Residents receive personal care services according to the requirements in R9-10-814A, D, E, and F. And 3. A recipient who has a Stage 3 or Stage 4 pressure sore is not admitted to the behavioral health residential facility. H. BHRFs with personal care services. BHRFs that are licensed to provide personal care services shall offer services in accordance with AAAC R9-10-702 and AAC R9-10-715. Contractors and BHRF providers shall ensure that all identified needs can be met in accordance with Arizona Administrative Code R9-10-814, Sections A, C, D, and E. Some examples of services are blood sugar monitoring, application and care of orthotic and prosthetic devices, application of topical medications, and use of pad lifts, respiration, and radial pulse monitoring. Additional information can be found in the Access Medical Policy Manual, Policy 320V, Section F for personal care services, and we have provided the link to that website as well. To continue with personal care services, any member receiving personal care services must have had an assessment by a medical provider indicating that the member's condition requires assistance with personal care. As a reminder, BHRFs must be licensed by Arizona Department of Health Services to provide personal care services. The need for personal care services must be documented in the member's assessment and service treatment plan and identify the specific personnel care services required by the member. HCPCS code H0018 with a TF modifier to identify intermediate level of care. Now we're going to move on to the claim submission information. Care and services provided are based on a per diem rate which is a 24-hour day. Prior and continued authorization do not include room and board. Criteria for admission and continued stay will be detailed in the new Access Medical Policy Manual, Policy 320V, again for behavioral health residential facilities. The claim form type for submission will be the CMS 1500 Professional Claim Form, the HCPCS code H0018. Modifier TF may be billed only when the birth is licensed by ADHS for personal care services and the services are included in the member service plan. Now we're going to go over some of the resources. We have provided the links to the Access Medical Policy Manual. Again, this is Policy 320V for behavioral health residential facilities. We provided the link to the Arizona Administrative Code, a link to the Access Behavioral Health Residential Facility Prior Authorization Requirements. We've also provided some links to the Access Web Page, the Division of Fee-for-Service Management Training Resource page, how to sign up for Constant Contact, which is our DFSM email notification system, Access Online Provider Portal, Access Claims Clues web page, Access Fee-for-Service Behavioral Health Outpatient Rates page, Provider Updates web page, and a link to the Medical Coding Resources page and Behavioral Health Services Matrix. That will conclude our overview today for Behavioral Health Residential Facilities, Access Medical Policy 320V. We would like to thank everyone for your participation and have a great day.